Hello, everyone. This is from Teresa, and you're listening to the Tra Tra Podcast, a show for people who love to learn about psychological theories. Today, we're talking about a psychological disorder called trauma. What is trauma? It is an emotional response to a terrible event, like an accident, rape, or natural disaster. Let me narrow it down. Trauma is when someone is going through a very stressful, frightening, or distressing event. It is how we're affected by our experiences. What causes it? Usually, trauma is caused by a shock from a terrible incident. Some common sources of trauma include rape, natural disasters, severe illness or injury, or the death of a loved one. Trauma is often, but not always, associated with being present at the event. It's also possible to sustain trauma after witnessing something from a distance. When you experience a traumatic event, your body's defenses take effect and create a stress response, which may make you feel a variety of physical symptoms. Some emotional, psychological symptoms include anger, irritability, and mood swings. Immediately after the event, shock and denial are typical. Long-term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headaches or nausea. Trauma may also lead to recurring dreams and lack of sleep, which causes other problems such as poor concentration and mood swings. This may greatly impact an individual's daily life by developing avoidance in social life, losing patience in work, or losing interest in general. Trauma-focused psychotherapies are the most highly recommended type of treatment for PTSD. Trauma-focused means that the treatment focuses on the memory of the traumatic event or its meaning. These treatments use different techniques to help you process your traumatic experience. Cognitive behavioral therapy. Doctors usually recommend CBT as the first line to treatment for people with ASD. Traumatic symptoms typically last from a few days to a few months, gradually fading as you process this unsettling event. Symptoms lasting less than a month are often referred to as acute traumatic stress disorder, but persisting symptoms are usually classified as PTSD. There is no definitive cure for post-traumatic stress disorder, but there are many types of treatment that can alleviate the symptoms. There are various therapy techniques, as well as evidence that medication may be useful for people struggling with symptoms of PTSD. So if you are having any kind of trauma, go to a therapist. This is something you can overcome with as long as you face it and treat it well. This is it for today's Tra Tra Podcast. This is Teresa, and we'll see you next week. Bye-bye.